Okay. Hi, my name is Sarah Rossmessler, and I'll be the nurse practitioner student examining you today. Can you tell me your first and last name and how old you are?
I'm Jeffrey O'Donnell, and I'm 10 years old.
And today we are planning to do a full physical exam. That means I'm going to examine you from head to toe. If there's any part of this exam that you feel uncomfortable with or you don't want me to do, you can tell me to stop. Are you feeling comfortable with this exam? Do you feel comfortable temperature-wise or anything I can do to help you make the room more comfortable?
No.
I may ask you to take off your shirt if you're willing to do that. If you don't want to do that, I can work around your shirt.
Okay.
Okay, I'm going to go wash my hands. So I've cleaned my hands, and is it okay for us to get started now?
Yes.
Okay. I'm going to start with his general appearance. Looks like a well-developed young 10-year-old boy. He came into the office. I saw him walk. His gait was normal. Arm swing was normal. It didn't look like he was limping or struggling at all. He's breathing easily. He's making good eye contact. He's dressed appropriately for the weather and able to make eye contact and engage with me in basic conversation. Okay, I'm going to start with his head. No, I'm going to start with his head. So, is it okay if I touch you from time to time? Okay. So we'll start with the hair. The hair is a light brown color. There's no areas of alopecia. There's no signs of infestation. The head itself is normal cephalic, atraumatic. I'm going to move on to the face and eyes. Okay, so face is symmetrical. There's no twitching. There's no spasms. There's no drooping. The eye brows are, his eyebrows match the color of his hair. There's no lateral thinning. There's no evidence of plucking or anything removing the eyebrow. Okay, his eyes are, the sclera is white. There's no injection. There's no evidence of conjunctivitis. Do you mind if I touched your eyes? The sclera is clear, no discharge. The iris is a very lovely gray-blue color. I would not say that. The pupil is, oh, I don't have my phone now. Okay, may I borrow your flashlight? Okay, so the pupil is about 3 millimeters. It is equal, round, and let's see if it's reactive. It's reactive to light and accommodation. Okay, we'll just go ahead and do eye testing right now. I have a card here with some letters on it. Can you read that card?
JHK3.
Okay, we have 20/20 vision. Can you cover one eye? Okay, can you read the lowest line that you can read?
JPLK.
Excellent. And switch your hands. Okay. Read the lowest line that you can.
JPLK.
Excellent. 20/20 vision without correction. Okay, we're going to do the cover test. So, Branch, can you put one hand over and then just remove your hand? And I'm looking for any lag in the eyes returning to their position. Can you do the cover test on the other eye and remove it? Okay. All right, we're gonna test your peripheral vision. Can you cover one eye with your hand? Okay, I'm gonna match you, and I'm gonna ask you to just tell me when you see my wiggling fingers.
Yes, 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 yes.
No, just wait till you hear.
Yeah. All
Okay. Now switch your hands. Okay. Yes?
Mm-hmm.
That's not right. This way?
Mm-hmm.
Okay. And I'm going to switch my hands. Can you see my wiggling fingers?
Mm-hmm.
Okay. All right, last test. We're going to have you follow my finger with your eyes. Try to keep your head straight. Okay. And we're going to come in. Okay, so there's your accommodation. So extraocular movements are intact without nystagmus, and no visual field cuts, and full visual fields to confrontation. Okay, now we're moving on to your nose. I do not have an otoscope, but if I did, I would use it, and I'm going to speak what I would normally do. Okay, so the nose is midline. There's no discharge. Can you obscure one nose and the other one? Both nares are patent. I'm going to look with my otoscope. Can you take your nose and push it up like that? Okay, I see the turbinates are pink. There's no bleeding. There's no excessive discharge. The hair distribution is within normal limits. No polyps. No masses, no lesions. Okay, we're moving on to the ears. Okay, so the pinna does not look like it has any evidence of infection, any masses, any lesions. He has one piercing on the left ear. Does not look like it has any signs of infection. The external canal is, I also am using my otoscope. I'm going to pull the ear back to straighten the ear canal. I'm looking and I see that the external auditory canal is the hair is evenly distributed. There's no excessive cerumen. I can see the tympanic membrane is pearly gray in color. Cone of light is at 5 o'clock. There's no bulging, there's no retractions, there's no erythema, and the landmarks are visible. And we're going to repeat that on the other side. I'm going to ask you, I'm going to touch your tragus and your mastoid. Any pain? Any pain if I move the auricle on either side? Okay. We'll do the whisper test a little bit later. Okay, moving on to your mouth. Lips are without cracks or bleeding. They're pink and moist. Can you open your mouth? Can I see your teeth? Teeth are white and dentition is in excellent repair. And open your mouth. The tongue is rugated. There's no plaque, lesions. The tonsil, can you say ah? Can you open your mouth a little wider? Tonsils are actually 1+. Uvula rises midline with phonation. Posterior pharynx is pink. There's no lesions, masses, bleeding. The salivary glands look patent. Hard and soft palate are pink, rugated, and without any evidence of trauma. All right, we're going to move on to the neck. The trachea is midline. I'm going to examine, if it's okay with you, I'm going to come around from the back, make sure that, and then can you swallow? Okay, the thyroid is spongy, butterfly shaped, no masses. Okay, we're going to go on to your lymph nodes. Okay, I'm going to do your sinuses. We're going to ask you how this feels, your frontal, your maxillary, and your ethmoid sinuses. Any pain? Okay. All right, now we're going to go on to tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital. We're going to do while we're here, the axillary nodes, central, anterior, and posterior on both sides. All lymph nodes. I'm going to defer the inguinal nodes because it's a sensitive exam. There were no palpable lymph nodes. Was there any tenderness when I touched anywhere there? Okay, so non-palpable, non-tender lymph nodes. Okay, now's the time if you wouldn't mind taking off your shirt. Do you feel comfortable with that?
Mm-hmm.
Okay. Are you still warm?
Mm-hmm.
Okay. Okay, we're going to start with the respiratory exam. First, I'm going to inspect the chest. He's breathing easily. His rate is about 16 or 18. There's no accessory muscle use, no tripoding, no pursed lip breathing. His AP to lateral diameter is about 2 to 1. Okay, so let's do a little bit of percussion. Okay, yeah, that'd be great. Thank you. Okay. Now I'm going to listen. I'm going to listen anteriorly. This is just your breath sounds. You can take some deep breaths in and out through your mouth. Okay. Okay. No areas of consolidation, no dullness on percussion, no wheezes, no stridor, and no crackles of any kind. All right, now we're moving on to your cardiac exam. We're going to start with, let me just palpate for any thrills. I'm going to locate the PMI, which is the fifth intercostal space mid-clavicular line. The PMI is a 2 centimeter gentle tapping, regular rate and rhythm. Okay, I've already I've inspected and palpated for any lifts or thrills, which I did not detect. And now we're going to listen. First with the diaphragm. So aortic, you can just breathe normally now. Pulmonic, herbs, mitral, and tricuspid. Okay, I'm going to listen with my bell. Same areas. No rubs, murmurs, gallops, or S2 splitting. No S3 detected, no extra sounds. Okay, we're going to move on to peripheral vascular. So we're going to start with your pulses. Carotid. I'm going to listen or feel here. Brachial. Brachioradialis. Posterior tibial. Popliteal. Posterior tibial. And dorsalis pedis. all pulses 2+ bilaterally. Okay, moving on to the abdomen. Would you mind lying down?
Do you want my head this way or this way?
Maybe lie down that way. That's good. Okay, so I'm first going to inspect the belly. I can see she really can't see, but that's okay. I'm looking at the belly and I don't see any, I do actually see his pulsation of his aorta, but there's no masses. The contour is slightly just flat, not concave or protuberant. So we're going to I'm going to auscultate. Normal active bowel sounds in all 4 quadrants. There's no hyperactive activity or hypoactive bowel sounds. Okay, I don't remember if we have to do bruits, but we're going to do I'm going to listen for bruits in the aorta, the iliac, and the renal. No bruits noted. Okay, now we're moving on to light palpation, deep palpation, I'm going to feel for the liver's edge. I'm going to palpate for splenic dullness. And I'm going to feel for the kidneys. In a child, the right kidney may be palpable, but this patient, it's not palpable. Okay. That's the end of my abdominal exam. Okay, so if I were going to, you can sit up now. Oh, I'm going to do CBA. Yeah, you can sit up, sorry. I'm going to do CBA tenderness briefly. No CBA tender, was that tender?
Mm-mm.
Okay. In a child of male gender, I would examine the penis, the testicles. I would look for inguinal, I would look for the inguinal nodes. I would look for any inguinal hernias. If the child was uncircumcised, I would look I would track the foreskin, look for any signs of infection. I would look for descended testicles, and I would look for the anal wink. And I would probably not do a rectal exam unless there was some concern. And that's what I would do there. Okay, we are moving on to musculoskeletal. Let's do your cranial nerves first. Okay. All right, we've done, I have my coffee here, and I'm going to ask you to close your eyes. I didn't say coffee. I'm going to give you something to smell.
Cinnamon.
Okay. All right, olfactory cranial nerve 1 is intact. Cranial nerve 2 is the visual, we tested that with our visual acuity test earlier. Cranial nerves 3, 4, and 6 are all tested using the extraocular movements, which were all intact. Cranial nerve 5, I'm going to test to see if you can have light sensation. Do you feel my finger?
Mm-hmm.
Sensory branch of the cranial nerve 5 is intact. Can I feel your jaw? Okay, and then try to push against me. Puff out your cheeks. Try to hold them. Good. Stick out your tongue. Okay, and push against my hand. You can stick your tongue back in. And shrug against me. Good. Okay, so you can put the tongue back in. Thank you. Branch. I forget your name. Okay, so cranial nerve, we're not going to test the gag reflex. Cranial nerve 10, shoulder shrug, 11 with the vagus. And so cranial nerves 1 through 12 are grossly intact. All right, we're going to move on to some cerebellar testing. Okay, so Branch, if you could just walk across the room and come back on your toes and go back on your heels. And can you take your, come on over here so you're in the, and can you take your heel and move it up your shin? Okay. And can you just stand like that and put your hands out in front of you and close your eyes? Okay, no swaying. So Romberg is negative. No cerebellar issues with any of those maneuvers. Do you want to pause it?
It's okay.
Okay, now we're going to do musculoskeletal. All right, you're going to follow what I do. We've already looked at the jaw. First, I'm just going to feel for any warmth in any of your joint systems, which I don't feel. I'm also inspecting them for any scars, lesions, masses, erythema, which I don't see. And we're going to try a few things together. Can you? Good. Okay, neck, just follow what I do. Flexion, extension, lateral rotation right, lateral rotation right, left, lateral bending right and left. Okay, onto your shoulders. Can you do flexion, extension, hyperextension? Can you do internal rotation and external rotation? Okay, onto the elbows with flexion, extension, supination, and pronation. Wrists, flexion, extension, radial deviation, ulnar deviation. Just squeeze my fingers. Okay. Now we're going on to hips. Can you do flexion, extension, and internal rotation like a gate, and external rotation? Great. And we'll do the other side another time. We have flexion and bend and extension of the knees. Okay, ankles. You can sit down if you like. We were doing flexion, extension, inversion, and eversion. Okay, that is on your spine. Because you're a child, and we take particular attention to the spine and any evidence of scoliosis. So I'm looking, I don't see any shoulder difference. Can you reach down and touch your toes? The spine is straight. There's no hip difference or curvature of the spine. Thank you very much for your attention, and I think I've done everything. I've probably forgotten something, but there it is.
Am I healthy?
You're healthy.
Yay!